Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. Delighted to be back in the chair with you this morning.
Yeah.
And I'm joined, of course, by Dana Hawkinson, or Hawkeye, Doc Hawk, whatever I happen to call him on any given moment of any given day.
That's right.
We are also very pleased to have our Chief Medical Officers with us today from a number of different health systems. So let's first let folks introduce themselves so we hear from them. Mark, do you want to lead off over at Truman?
Sure. This is Mark Steele. I serve as the Chief Clinical Officer here at Truman. Oh, Steve?
Yeah. Hey, is that, I don't know if I have Mark or Larry on the line right now. Is that Larry?
No, this is Mark Steele.
Yeah, Mark, how's it going over at Truman right now?
Yeah, so at Truman, we have seen a significant uptick in cases since I was last on, and we currently have 24 patients in the hospital with COVID, 8 are in the ICU, and 4 are currently on ventilators. We are seeing an increase in younger folks requiring hospitalization compared to before. Currently, about a third of our patients admitted are under the age of 50, with 2 being in their 20s and 4 in their 30s. And we have 1 sick intubated patient in their mid-30s and another intubated patient in their mid-40s. So I think this highlights how serious COVID can be, no matter your age, but granted poses higher risk to those who are older or have underlying medical conditions. In an effort to help prevent transmission of the virus, where we were recently back out in the community handing out face masks, we're very passionate about folks wearing face masks to help protect themselves and others. As you know, it's been reported that up to 35% of patients with COVID have no symptoms, and that over half of the new cases may result from exposure to asymptomatic individuals. So this really highlights the need to consistently practice social distancing and wearing masks, the 2 main weapons we currently have to help prevent the spread of the virus when around others. Last week, a handful of our physicians and I were out at the Negro Leagues Museum dodging traffic to hand out masks to passersby. Later in the week, we teamed with St. Luke's to deliver 40,000 masks to area church leaders for them to distribute to their congregations. We were doing a lot of community testing, but very recently obtaining test and reagent for us has become quite a challenge, as it has for others, I believe. As a result, we're currently having to send some of our testing out to the commercial labs, where the turnaround times have been very slow due to them being overwhelmed with testing demand. And it's also my understanding that they also face some of these reagent shortages that we face here currently. So that's kind of currently the highlights here at Truman.
Yeah, and that's unfortunate. And boy, I just totally applaud the great work that you and others and Luke's have done out in the community working on the face mask issue. It's just a shame it's become politicized as opposed to being, I don't know what the right word is, healthicized or medicalized. It needs to be viewed as a healthcare issue, right, and not as a political party issue, because it's just real. So, well, thank you, Mark, and thanks for joining today. Larry, I think, are you on the line?
Yes, I am. This is Larry Botts. I'm the Chief Medical Officer for Advent Health Shawnee Mission. We have been pretty fortunate in the last week. We saw about a week and a half ago, saw a tiny little surge. But honestly, we're back down to numbers where we had been for several weeks prior. Our inpatients are at 9. We only have 1 person in the ICU. We don't have anybody on a ventilator. So we feel fairly fortunate with that. Our outpatient positivity rate has gone up, however. And again, just I think as Mark outlined, this has been mostly in the younger population. The age of those that are positive has decreased significantly. That's probably why we are not seeing quite as many inpatients, as those people are less severe for the most part. And therefore our hospitalizations haven't gone up. But we went from about a 4 to 5% positivity rate in our symptomatic outpatients 2-3 weeks ago, and last week it was up to around 12, and I think it was still increasing. So we've been fortunate also in that we've been able to test as many people as we have. In fact, we've had some increase in our outpatient testing, and that's thanks to Maud Laboratories here that's been able to partner with us to do that. And those, as I said, those positivity rates, in addition to the rate of positivity going up, we just have a greater number of positives because we are testing more people. And one interesting phenomena is that our asymptomatic patients that we're testing pre-procedure and pre-surgery, those positives have not really seen an increase, and we're still at about 0.3 or 0.4%. So at least in that population of asymptomatic patients, the rate is remained fairly low. But I don't think that's the case across the board as outlined by Mark. I would second his plea for everyone to wear masks. I think that is the one thing that we can do that can slow the spread, and hopefully that has helped. It is too bad that it's politicized, but it is something that is important, I think, and we need to keep stressing that.
Yeah, thanks, Larry. And man, yeah, and I mean, it's good to hear that someone else is a little lower. That's kind of where we are. We'll talk about that in a moment. But first, Dr. Adega, how are things up in Liberty?
Hi, good morning. Liberty, I'm Raghu Adega. I'm the Chief Medical Officer here at Liberty Hospital. I wish I could echo what Larry is experiencing there, but unfortunately here in the Northland, things are a little different. As you know, weeks ago we were in a lot better shape than a lot of you guys down south, but things have changed. When I spoke to you guys a couple of weeks ago, most of our inpatient population of COVID used to be coming from the long-term care facilities. Even that has flipped in the last week or so. So as of now, we've got 14 in the hospital, 2 in ICU intubated. Looking at the numbers from yesterday, the 14 that we had yesterday as well, a lot of them are younger. So just like what Mark talked about, in our 14, 8 of them were less than 60 years of age, 5 of them less than 50, and in fact 3 in the 30s. And of them, again, 9 of the people came from the community, 3 from nursing homes, 2 from group homes. A lot of them, in fact, a couple of them in 30s have no underlying medical problems. So this really speaks to what Mark and Larry talked about, the need for distancing and wearing masks. Unfortunately, whether it is people's underlying politicization and beliefs, or is it just the good old fatigue? Whatever it is, I think we've let the guard down, and the community incidence is just going up and up. So that's my concern. And in terms of hospital, we are okay in terms of our ICU capacity and ventilators and all that. Overall bed capacity, especially if we end up needing a lot of negative pressure rooms, that's a concern of mine. I've been told that one of the nursing home chains is considering converting one of the long-term care facilities in Liberty to a COVID facility. So that will put a lot of pressure on us for hospitalization. So I'm kind of pretty busy today preparing for that. PPE is always a little tight, and we have to keep changing instructions to our staff about every time we buy from a different source, it's a different color, different material, so there's going to be a lot more education. So we deal with that. But we do work on, informing our community as much as possible with our relationships with local, the newspapers and all that, about the stressing on the masking and distancing and all other public health issues, and work with the health department, of course. So we've been the busiest that we've been with COVID in the past few months.
Well, and thank you for the good work. It does sound like you're going to be busy up there. Good luck on the nursing home issue, and thanks for taking time to join us today. Dana, how are things here at KU?
Yeah,
we've been okay.
We've been okay. I was a little bit happier yesterday and the day before, but overnight we had 20 on the last run this morning from our most updated data. 21 patients in the hospital, so we're kind of really in the same boat with Liberty and with Truman. 9 of those 21 patients are in the ICU with 3 on the ventilators. So our numbers, unfortunately, do tend to be ticking up. But again, these are 1, 2, 3 day samples. We continue to look at the full day rolling, 7-day, 10-day, 14-day rolling average. But certainly our numbers seem to be ticking up as well.
But ticking up yet stable in that low 20 range, and we haven't jumped up to the 30 range yet. And we're hoping that continues. So let's first see if there are questions from media this morning for any of our terrific panel today. Not hearing any, we'll turn to the public, and because we know, Jess, that always are. So
yes, lots of questions already coming in. Okay, so this is a two-part question. A viewer wrote in, and then also Nancy wanted to know. She said that the number of cases and of deaths in America are, quote, freaking people out. So she said, could you explain when somebody tests and then has to go back for another test? So there's another test and another positive test. So maybe somebody has 2 or 3 positive tests. Are those counted towards the positive numbers? And then also, someone was asking about presumed positive tests being counted in Kansas. So can you address the presumed positive cases and multiple tests for one person?
I'll take the easy one. I'm going to do the presumed positive ones. Those don't count. You're tested once, and you got to be positive to be counted. They don't test you unless we know you're positive. Right. But the multiple positive tests, I don't think that counts. But I'm going to ask Dan.
Yeah,
so
I'm pretty certain that it doesn't. I'm pretty certain it's based on a individual case-by-case basis. So once you have a positive,
you're positive.
If you go back 2 weeks later for another nasal PCR, they are not going to recount that test.
Yeah, because you're positive. You can be positive for months.
Unique patients, right? Yeah. These are unique patients. So.
Does any of you think any differently? I don't know, Dr. Adega, you're one of our other infectious disease doctors amongst this panel. Any other thoughts about that?
No. Unless there is any error in counting, they take a patient identifiers. They take the name, date of birth, and other information. So there is matching that is done at the counting level. So there is typically no reason to double count anyone.
Yeah, and the way it works is when you have a positive test, that data gets sent into the county and to the state. The state then reports it nationally, and so they're going to report you one time.
All right, good to know. So Betsy and Roxanne both have the same question, because they have the same health issue. She said, I have a primary adrenal insufficiency and I'm on hydrocortisone daily to keep me alive. Will the hydrocortisone help me any if I get COVID?
Larry, what are you thinking about hydrocortisone and steroids today? What's your sense? You're a pulmonary critical care doc by training, so I'm going to pick on you.
Oh, yeah, thanks. That's a tough one.
Yeah.
Well, I think we use steroids in a lot of different diseases, and certainly in inflammatory diseases like this, it is always a thought as to a possible help. I'm not sure that there's enough evidence out there to say one way or another that it's helpful. I don't think anybody's recommending steroids in COVID from the standpoint of treatment at this point. And just the replacement dose for the hydrocortisone for the adrenal insufficiency would not really have much of an effect on the overall disease course from COVID. It would be a much smaller dose than we usually use for therapeutic doses of steroids. That's the best I can do, Steve. I don't know if anybody's going to answer the question.
What I know is that prophylactic steroids are not going to be helpful. We already know in the transplant population, they're not only on some steroids, but other medications. They may or may not, depending on which article you read, be more vulnerable. There is maybe a role for Decadron-Dana in some treatment of more seriously ill patients, though. At least there's some early evidence to suggest that, and whether or not that's really true, as we always say, give me 2 weeks, we'll be a little smarter.
Right.
And then the 2 weeks later, we're not as smart, but we you never know.
No, I completely agree. I think we have seen that in prophylaxis trials, meaning trying to prevent disease after you've been exposed or prior to exposure, we've seen a number of drugs that have not really helped. So the big one in the New England Journal from up in Minnesota showed no benefit of hydroxychloroquine. There's another hydroxychloroquine prophylaxis study going on now. We know, just as you said, patients who are on immunosuppressive drugs, whether it's for transplant or other things, because people are on other long-term steroids for other reasons, they do not seem to have any difference in acquiring infection nor overall difference in severity, those people can still get very severely ill. However, for treatment, certainly dexamethasone has shown, there's a good body of evidence, shown that it really can help and increase overall morbidity, mortality, and outcomes if you're giving it. And certainly I think timing of these drugs is very important as well. So I would agree with that. Certainly not for prophylaxis though, and especially as Dr. Botts had talked about in that dose, I don't believe it's going to be beneficial. You'll still be susceptible to infection and to progression as well. So,
Sheila wants to know, once you have had the virus, do you still have to wear the mask? I think what she means is once you've had it and you're over the symptoms, could you still transmit it to
You
somebody
bet.
else?
Mark, you guys have done great work on this masking folks and trying to get that out to the public. What's your sense? If you've had the virus, it still feels like a mask is going to be a good idea.
Yeah, I think so. I think we don't know for certain once you've had it that you can't get it again, or that you may not, I mean, depending on the timing of how long it's been since you had it, and can you still be spreading the virus. So I would still strongly advise that you wear the mask.
I think that would be my sense,
Yeah.
especially because you may not get as sick from the virus again. It doesn't mean you don't have the virus. And so I think that's right. The advice has got to be wear a mask, wear a mask, wear a mask. And I know, it's hard.
Yeah.
People don't want to wear masks,
No.
right? Dr. Daigle, what are you doing up in Liberty to try and make sure folks continually wear masks? I know you must be staying on message a lot with that.
Yeah, it's a tough task, even among educated people. We are talking about public wearing masks, and it would be crucial that in the hospital, everyone, whether it is staff, whether it is visitors, families, wear a mask. And in fact, even able patients, if they have to be out of their rooms, we make them wear masks. Yes, how do we do that? It's education, education, education. And so we kind of tried to ingrain into everyone's, head, including the directors and managers and whoever. And, we had some pushback when we started, well over a month or two ago now, that universal masking. Every time you see a mask that is hanging by the ears or below the nose, we gently approach and talk about, proper use of mask and drill into them. It is not only for your own protection, it's for everyone else's protection. So getting that into their head. And one important area that we recognized also is the breaks. People wear it, but if they're taking a lunch break and if they're sitting together, that's a really high, area for transmission between people. So we kind of worked on how to stagger their breaks and try to get them distanced enough to, do their whether it's eating or drinking. So trying to minimize, if at all, any time when they had to get the mask off. So it's a constant effort.
It is. It's a hard one, isn't it? Okay, so here's my story of the day. Everybody knows I love to tell stories, and sometimes they're made up and sometimes they're real. So we're going to claim that today is real. So let's say you're walking down the street, and Patrick Mahomes, the new $400 or $500 million man, is coming towards you, and you're a Chiefs fan, like I am. And all of a sudden, you think to yourself, do I have my mask on? Because by God, I'm going to protect Patrick Mahomes, right?
Yeah.
I want to protect Travis Kelce. I love that picture that's up there right now. Help keep Patrick Mahomes safe, wear a mask, darn right. I'm walking in front of Tyrann Mathieu. I'm walking in front of Chris Jones. I'm walking in front of, name your favorite player. And so the entire Royals baseball, whatever it may be. Would you really not wear a mask when you're going to go up and say hi to those guys? Well, of course you are. And of course, they're going to want you to wear a mask. And I can guarantee they will have a mask on. So if you want to keep Patrick safe,
Yes.
don't you want to keep everybody safe?
Yes.
The logic doesn't start with how much money somebody makes.
Right.
It starts with trying to keep each other safe, because in this way, we are each our brothers and sisters' keeper. This is not politics. This is healthcare. And we have to see it for what it really is. Despite all the folks who are out there with shrill voices trying to tell stories about this, the people who are in the know are the ones who do this every single day. And I guarantee you that when your surgeon operates on you, he or she has a mask on. And they're doing it for one reason. They're doing it to keep you safe. So let's keep each other safe.
Here's a question. My sister lives in a small town of about 30,000 people in Florida. They have over 300 COVID-19 cases in their town. Her question is, should they move back to Kansas to be safe from the virus?
Oh boy, we're going to get into a little epidemiology here. That's going to be a fun one. Okay, Dana, I think moving back to Kansas is probably Larry and I and you. And so let's take that one. Larry, what do you think?
Yeah.
Should they move from Florida to Kansas?
Wow, that's a tough question.
It is a tough one. I'm nice to you today.
I mean, yeah, you're not being nice to me at all. It's interesting. I just heard yesterday that Connecticut, New Jersey, and I think New York added Kansas to its list of travel restrictions. If you travel here, you evidently have to quarantine. So I don't know. I think that I think certainly the incidence in Florida is much different than it is here, although it's still increasing here. We have, as you know, Advent Health's headquarters are in Orlando, and we are being inundated and almost to capacity down there. So there's certainly some evidence that they're having a much more difficult time there with the number of outbreaks. But I think that if you take your precautions, I think you can, any place that has community spread, whether it's here, whether it's Florida, I think that you protecting yourself and doing what you need to do, and hopefully with the rest of the people doing in their small town, I'm not sure that it would behoove you to move from one place to another to try to avoid it.
I think that's Dan.
I would agree. Yeah, absolutely.
And I think, people when they ask that question, they're really asking an incident question. Is the incidence there? They have 1% of the population. If it's 300 out of 30,000, I think we're at 1% or higher. Now, I don't know if the 1% are currently active. But the other question to ask is, how are the healthcare resources? Larry, I think you touched on that. Is what are the healthcare resources? Are the healthcare resources overwhelmed? In which case, maybe. But by and large, the virus is everywhere. And if you move from an area where it's not, where there's a lot, to an area that isn't very much, that area that didn't very much, the rate things are going to be a lot soon. And so I'm not sure that moving on the basis of disease incidence is helpful. I think if the healthcare resources are overwhelmed, that's a different question. Yes.
Okay, got some good ones here. This is from Evelina. She has a daughter who has asthma. They've been isolating since this whole thing started. Family thinks it's not that big of a deal. Some family members think that she's even harming her daughter's immune system by not exposing her to germs. How true is that? Could she be harming her daughter?
Yeah, Mark, this is a question that's got to come up in all of our communities a little bit. Do you think it's making people unsafe or sicker by not getting out and getting exposed?
No, absolutely not. I think that, and particularly, even though it's a young person, but they have an underlying illness, and so getting out and exposing yourself may actually end up being absolutely the wrong thing to do and put yourself at unnecessary risk.
Yeah, I think that's true. And Roger, I think you would probably agree that we're colonized by bacteria all the time. It's not like we got to go out and find more bacteria or more viruses out there.
That's right. And, obviously there are some good ones and there are some bad ones, and this would be a bad one to go catch.
That's right. Let's have a choice here.
Yeah.
Wheel of Fortune. Okay.
Okay, so Kristen wants to know, should you get tested if you do not show symptoms? She does not have any underlying health issues, but does live with elderly parents that do have them. She says, we stay home, but we do have a kid playing in softball, and we go to local farmers markets.
Oh, yeah. Gosh, this is hard to know. Yeah. When do you test, Dana? And it's because you could kind of randomly sample everybody all the time, and I don't know what that's going to get you, but let's talk about that.
There are different opinions on this. Certainly, we would like everybody to get a test every day if they wanted it, if there was capacity, if there was the resources. We've just heard this morning that testing capacity is down because there's resources and there's holding back of some of the vital components we need to do the testing. So as far as contact tracing goes, if you are exposed to a known case, we continue to recommend not getting a test unless you are symptomatic. And that's because that test is really good for that day or maybe the next day, and that window is very short. This will help with testing capacity, but also a lot of places, as was mentioned too, the turnaround time may be 3, 5, 7 days. So in that time, you can develop symptoms. So testing is not a way to get out of the quarantine. So at this point in time, if you're otherwise not having symptoms, whether you've had contact with a COVID patient or not, the best measures are continuing to use masks, as we have talked about, distancing, and hand hygiene. But just going out and getting a random test is probably not the best way to go at this point.
And besides, if you've had a known contact, you've got to wait how many days, really?
Yeah.
You've got to wait 5 to 14 days to
Right.
actually get some decent results.
Yeah.
Otherwise, you could be too early because you may not develop the disease for 1 to 2 weeks after exposure.
Yep. And that's why the 14 days, and that's where the 14 days comes from, really, is you can incubate. Although most people will have symptoms 5 to 7 days from infection, you don't want to get too early because you could be in that really pre-detection window.
Yeah.
Do we have time for one more question?
Yeah, I think we have time for a couple
Couple
more,
more,
and then,
okay.
then we'll wrap up.
Okay, Allie wants to know, are we anywhere near the peak?
Oh, boy. Okay, let's see. Who do I want to pick on for that one? Guys, anybody want to volunteer for the peak question?
I volunteer, Dr. Hawk.
He volunteered, Dr. Hawk. I love that. Okay, Hawkeye.
Yeah. Well, I think if we just overall stop testing, we've hit the peak.
Yeah.
In real life terms, though, I do not feel that we are at the peak. I feel that we are still in an expansion or inflammation mode of the infection. If we started from, say, February, we did have the shelter in place, which I think really helped a lot.
Oh, clearly.
But now after the opening up, and whether it's family get-togethers, whether it's get-togethers at bars or pool parties or anything like that, and from the numbers that we're seeing every day, we are continuing to see infection after infection. I think we are still really in the expansion period. I do not believe that we've reached the peak at all. And we really won't know that until we have full testing capacity available and all the reagents and all the supplies we needed to do the testing.
The reality is we bent the curve and we had to open up, right? I mean, the economy, people's jobs, and having a living, taking care of your families, those all make sense. The question and the part that we have to work on is opening up doesn't mean being reckless.
Right.
It's being reckless that gets us in trouble. And what we know right now is that the things that are driving the rapid increase are reckless behaviors. Now, in a normal way, they're not reckless behaviors, but in this day and age, they are. And so if you go and you don't get distance, you go to a bar and everybody's together, then all of a sudden, whereas yesterday that was okay, even though we are open, it doesn't mean we're reopening back to the past. We're reopening to Corona. That's how we have to think about it. You're opening yourself up to Corona. How do you solve for that? You solve for that by wearing a mask and making sure everybody else around you wears a mask, because if you do that, you can stay safe. You can even go to a bar and have a drink. One drink, don't get too close, don't lose your senses about you.
Yeah.
But wear a darn mask. Now, is that what it was like before? Nope, not at all. Is it better than sheltering in place? I say it is. I think it is, and it keeps people employed. So you can do both. You can stay safe, but you got to be responsible. Last question.
We're going to start getting a lot of these questions over the next couple of weeks, but
You asked me a
Nancy
school
says-
opening question
Yeah,
right now. Here we go.
So
No.
Nancy wants to know, she says, I know Doc Hawk says that we need to get back to school, and I agree, she agrees, but all the hype says this is not the right thing to do. Who is right?
Who is right? Well, first, before we ask Hawkeye, let's ask Larry Botts. Larry, I'm giving you all the easy questions today. Why stop now? And then I'm going to Mark after that.
I'm not enjoying for now if you're going to pick on me like this. This is a tough one.
Here's the problem. I don't think any questions are easy.
I have 5 kids, so
Oh, perfect.
School's a big deal. I don't know what the right answer is, and I don't think anybody does. So I think there's a lot of opinions out there. I'm of the opinion that we need to get back, the students need to get back, they need to be in school. I think our experimentations with some of the home studying in the last 3 months have not gone as well as we would have hoped. And And part of that may have been we just weren't prepared and didn't have the time to prepare. But I think there's a real benefit from being together. I think there are some things that you can do to try to mitigate the risk. They've looked at a lot of different possibilities, half classes, half days. I think whatever we can do to mitigate the risk, but still get people back to school is the best answer. At least in my opinion, I think that's the best answer.
Mark, what are your thoughts over at Trimmings? I suspect you guys are working with the school districts on the Kansas City side.
Well, my thoughts are similar to Larry's. I mean, I think that trying to get the kids back is the right thing to do. But obviously, we're going to do that, need to do that in as safe a way as possible. And so obviously, you got to wear masks and got to have appropriate social distancing and hand hygiene and all those kind of things.
Yeah.
Raghu, your final thoughts?
Yeah, I'm with everybody else too. I've been advising the North Kansas City School District here as well. I do think we need to reopen, but we need to reopen carefully. They do have different threat levels and different plans in place to, put in place, whether it is distancing, masking, or whether we need to go to, reduced schedule and some kind of a hybrid model. That depends on the threat level. And the biggest problem really for the schools is the resources, and I think we need to get whoever provides the resources to them more resources so that they can do it right.
Yeah, agreed.
Doc Hawk. Absolutely. We've always said we need to get back to schools, but we qualify everything we say by, at this point in time, what we know. It's important. It's just like the economy. We need to get back to the economy. We need to open up, but there has to be thoughtful ways of doing that. And it has to go on the pillars that we've always talked about. Exposure is essentially proximity to that person and duration of time next to that person. And if you can do it outdoors, certainly I think some schools, I've been talking with some people, are looking at maybe some outdoor things as well. So there are ways to mitigate the risk. The CDC has published guidelines now and guidance on optimal practices. It's up to every school district and every school to try and do that as much as possible to protect the children, the teachers, and the other support staff.
Yeah, so important. Well, I think we'll wrap up today. Jess, I heard there was one last question I needed to try to answer.
Yes, can you explain to our viewers why you and Dr. Hawkinson do not wear masks in our studio, please?
We do. Yeah. So we very carefully go more than 6 feet apart. In fact, we're 7 to 8 feet apart. And today, I know we're probably even more. Yep. And when there's 3 of us, we have it measured so that we can be more than 6 feet apart. And we also know that we've had a temperature check in the morning and that we're not symptomatic. So we think we're safe like that. As soon as we're done with this, we walk out in the hallway, our masks are on, they're on for the rest of the day. And finally, the other reason is it's really hard to understand us over the microphone if we wear it. And so that's not an excuse, it's a reality. And so when we're here, we measure to make sure that we're far enough apart.
Yep, again, time and proximity. We are distance. We have our masks on. We come in, we take it off probably about a minute or 30 seconds prior to starting the show. I have it right next to the table beside me. Right after this, we put it back on. We wear it around the hospital all day, even in offices, even in the halls. So that's very important to do. We need to really continue to get our message out, as was done here today, about the mask. As we said, Patrick Mahomes. So Patrick Mahomes is young. He's probably less likely to get ill, but he has family. And he has loved ones, and so we don't want anybody or anybody's loved ones to get sick. Now, Tyreek Hill can probably outrun the virus, but I would still recommend wearing a mask, and we need to really change that mask culture. There was a question today about masks with zippers or openings so you could eat and drink. I think that's okay to talk about later. Let's get everybody in a mask first, and then we can talk about that kind of stuff.
That is a great answer. So, well, listen, any final thoughts from our guests today? I'll start with Mark.
Yeah, so Steve, thanks again for having me. You talked earlier about the Chiefs, and football is obviously a team sport and takes everyone to participate and pull in the same direction. And from my perspective, we need everyone out there to be on the team to help us prevent the spread of this virus. And so my final words would be for everyone to stay safe, practice good hand hygiene and social distancing, and please wear masks as recommended to help protect yourself and all of the rest of us.
You bet. Larry? And you have to come back, Larry.
Absolutely agree. Yes, and only in jest. This is a great forum. I really want to thank KU and Steve and Dana for putting this on. I think this is very informative, and I think it's really helpful. I'm hoping it's helpful to people. It's been helpful to me. So thank you for the opportunity to do that. And I will come back, I promise.
You guys are the keys here. Dr. Adega, Liberty, what's going on? Anything else?
Yeah, no, thank you for inviting me back. And I just want to remind people that we will get through this. And I think we are probably in the second quarter. And I think we will, this will be over probably sometime next year. But we will get through this. Just team play is all that we need to do.
Yeah, totally agree. Hawk, anything else from your standpoint?
No other thing.
I agree. Guys, thank you all so much for being on this. And
Great show.
And remember, everybody looks good in a mask. We'll see you tomorrow.
Cover this up.